Hello everyone. As we know, the breastfeeding week celebrated every year between 1st to 7th August. In our institute also we are celebrating the breastfeeding week. So during this week I am going to release a one topic which is related to the breastfeeding. So today you will learn the introduction and awareness on the cultural beliefs and practices of the breastfeeding in the society. And in next few days I will cover the all other competencies which will explain the physiology of lactation, what are the types of breast milk and composition, advantage, what is the correct technique, what is BFHI, and also we have to identify the common problems during lactation, example retracted, cracked nipple or abscess. Then how to educate the mother on antenatal breast care and how to prepare the mother for the lactation and how to counsel the mother for the best practices in the breastfeeding. And also in competency 7.11, this is mentioned that every undergraduate student should also participate in the breastfeeding week celebration. Then in brief about the IMS Act and the early initiation of the breastfeeding by the breast crawl method. So in next 1 week, I am going to cover all these competencies. Whenever we are doing the counseling, we should explain to the family members and the mother that breast milk is the best gift for the baby that mother can give. It is also observed that the human are the only species among the mammals who go to the other animal milk for their babies feed. We should always explain them that all the benefits which baby will get from the breast milk, better IQ, prevention from the various infections, allergic disorders, and we should help the mother so she can start early initiation and she can continue as exclusive breastfeeding for the baby. In this image you can see this bottle feeding infant milk formula and animal milk are not made for the human being. Whenever they are giving this milk, baby will not get the complete nutrition and chances of various infection will increase. So always they should give the exclusive breastfeeding. Whenever they are giving the suboptimal breastfeeding, there are chances of neonatal mortality increase by 5% and diarrheal death 30% and acute respiratory infection 18%. And also 10% disease burden in less than 5 years age group are because of suboptimal breastfeeding. If they initiate the breastfeeding after 1 hour of the birth, it will double the risk of neonatal mortality. So this part should be explained to the parents. Breast milk is the best gift for the baby which mother can give. It is Matratva Vardhan. And by these three images of our goddess, you can understand the importance of breastfeeding. By giving the breastfeeding, mother is giving the protection against various infections and allergic disorders. So, providing the Shakti or power to the baby. And whenever baby is breastfeed, having the better IQ compared to those who are partially or not breastfeed. And also money will be saved whenever breast milk is given because for infant milk formula and animal milk they have to spend almost 3000 to 4000 every month, and also time is required to prepare the infant milk formula. So time and money both can be saved whenever they are giving the breastfeeding. Early initiation of the breastfeeding within half to 1 hour of the birth should be done. Exclusive breastfeeding up to 6 months of life should be continued. Means no other feed, no water, nothing should be given in first 6 months of life. And they have to start the complementary diet at the 6 month of age with breastfeeding. And they have to continue the breastfeeding with the weaning food up to the 2 years of age. Colostrum, yellow milk in the first 3 days of life is the best milk for the baby. It is golden yellow welcome drink for the baby. It is first vaccine of the baby, and it also give the protection against neonatal jaundice. It is rich in the various nutrients, vitamin A, immunity providing substance. I will explain the details of colostrum during my one of video on the type of breast milk. There are various myths about the breastfeeding. So, awareness on the cultural belief and the practices of breastfeeding. There are various good practices and various bad practices. So, we have to clear all the myths they are having in mind related to the breastfeeding. Example, they think that colostrum is harmful. We have to explain them colostrum is the best milk for the baby. That's why they discard the colostrum in first 3 days of life. Instead of giving to the baby, they just discard it. And giving the pre-lactal feeds instead of giving the colostrum in first 3 days. They think that a small breast produce the less milk. That's why we have to give the other top milk, infant milk formula. We have to explain them every mother can produce a sufficient milk for the baby. They think that breastfeeding cannot be given in lying down position, only sitting position is required for the breastfeeding. So again we have to clear it. Breastfeeding cannot be start early after LSCS. It is also the myths. So generally after LSCS they are giving the breastfeeding almost after 1 or 2 days. So we have to explain them whenever LSCS is there, they can start the breastfeeding in left lateral or right lateral position within 4 hours of delivery. They think that weaning food or bottle feeding should be started before 6 months. We should also explain them that exclusive breastfeeding or breast milk is sufficient in first 6 months of life. No need to give the other milk. And also adequacy of the breast milk, how they can assess just by counting the urine output 6 to 8 times in a day. Baby is gaining proper weight. Baby is sleeping comfortably almost 2 to 3 hours after feed, and mother is having the ejection of breast milk from another breast is the sign that mother is having the sufficient milk. Breastfeeding should be stopped by 1 year, otherwise baby will not learn how to eat. So we should explain them. Baby can learn the other food items also with the breastfeeding, and breastfeeding should be continued for 2 years. If mother is sick, then cannot give the breastfeeding. Example, if mother is getting any infection, URI, viral infection, then they generally stop the breast milk. But we should explain them. Mother should continue the breastfeeding even with the fever or any illness. Whenever we are doing the counseling about the breastfeeding, we should explain them that baby will be healthy and giving the proper nutrition by the breastfeeding, and baby will look like this. And whenever they are giving the top milk, then chances of various infection and baby can become the malnourished. So by breastfeeding healthy baby and by bottle feed or animal milk, baby will be malnourished. So thank you so much. It is the introductory part about the breastfeeding. Tomorrow I will cover the next competencies.